My name's Nick. I'm an F2 working at Guy's, and with me is Charlene and Sadhana, who are F1s working over here at St Thomas's. I guess more importantly and relevantly for this talk, we sat the SJT exam, me 2 years ago and then 1 year ago, and I remember, I went through King's, and I remember feeling pretty underprepared when I was in your situation 2 years ago. Because I felt lots of people were able to offer sort of vague bits of advice and lectures on how to be a good doctor and things like that, but no one really seemed to know what the exam was about, what people are looking for, and what you can really do to maximise your chances and do well in it. So essentially that's what we wanted to do, is just give you an honest perspective of our experiences, what worked and also what didn't work now that we can look back on it and having spoken to other people. So I hope you're able to take something useful away. And if you have any questions, we'll go through that at the end. So even now, there are probably still people who will say that there's nothing you can really do to prepare. The best thing is to just go out the night before and just rely on your innate character and hope it does well. And I guess, I don't personally agree with that, because I think even though this exam does test your innate character, there are a lot of things you can do to prepare yourselves to maximise your chances. Even if you didn't do philosophy or you don't really have a great grasp of medical ethics, I think if, I had a teacher in secondary school who said, don't try and predict the answers, always try and predict the questions. And so if you sort of know what you're looking for and know what's expected of you, that's probably the best way to stand a good chance of doing well in this exam. If you go on the FPass website, nowhere do they say, don't bother revising or just carry on going and turn up for the exam. They say that they expect you to be familiar with good medical practice, which is, I guess, their equivalent of a textbook or a syllabus, and also to be familiar with the job of an FY1, which in itself is quite a lot, and we'll go through how to get a good idea of what those things are and how to apply those things in the exam. So next step is, before we go into talking about our experiences, is how important is it, compared to all your other exams from med school, and I think it is really important. It makes up 50% of your FPass score, and although FPass say every F1 and F2 placement should all be the same, and you should have, everyone loves their F1 job, which they do, I guess. But if you have any preferences of where to go, or you have any desire for a specific speciality, and there is a way to maximise your chances of getting that at this stage, I think you'd be silly not to try and do your best to try and achieve it. So it makes up 50% of your score, and in a way it actually counts for more than your educational performance mark, because your EPM ranges from 34 to, if you top your year and get a PhD, you get 50. So 34 to 50, which is a range of 16. Whereas in your SJT exam, your mark can actually range from 0 to 50. And although on the graph it does seem like most of the marks range from 30 to 50, you can technically score 0. And this is it for 2014. Again, a similar sort of shape. And if you read the results of all the analysis or papers, 12 people in 2013 didn't pass FPass and had to redo the year because they didn't do well in this SJT exam. It really has a big impact on where you go next year, because in 2013, when they mocked up the marking of the exam and got a couple of questions wrong, the whole remark process messed around 20% of people's scores. So 8,000 or however many medics there are across the country, 20% of people's scores changed, and 148 people's jobs were changed as a result of a couple of marks going either way in the SJT. So everything, this exam is pretty important and can make a big difference. And so in a way it's worth more than your marks throughout med school. So I guess if you've underperformed throughout medical school, then this is a good chance to sort of boost your, to pass and do well. Because in a way your scores don't really go any further than this in your med school. And I guess if you have done really well throughout medical school, this isn't the time to get complacent, because you can drop quite low if you don't do well in this single exam. Okay, so now that was the introduction. What we want to cover in this talk is, I'm going to go through the background of the exam. So the idea being, if you know who wrote it and what they're looking for, you'll better be able to approach the exam in December. Then the structure of the exam and whether that impacts how you should view the exam. Then I guess the real money slides are our personal experiences, what we did that we thought worked well, having spoken to other people, what didn't work and what we would do if we had another chance to resit it now. And then in the end, we'll go through the materials that are available to help with the exam, and then we'll look at what you should be doing or what you could be doing now to try and increase your chances. Okay, so firstly, the structure of the exam. The marks that count there are 60 questions that count, of which there are 40 where you have to rank 5 options, and then there are 20 where you have to pick the top 3 answers. And each question is worth around 12 marks, so each question is pretty much equivalently weighted, so there's no point spending more time on one than the other. There are also 10 questions in the exam on top of this which don't count for anything. They're just pilot questions, but you won't know which ones they are, so I guess you have to approach each question like it does count. So yeah, each question counts the same, and 70 questions, although it doesn't sound like much, it is quite a lot, and I guess that brings me to my first point, which is you have 2 hours and 20 minutes, so 2 hours and 20 minutes to do 70 questions, which works out to around 2 minutes per question. And 2 years ago, when I was going through some of the practice questions, I was able to, I think, work quite quickly through some of them. So when I sat the exam, at the start, I didn't really think that much about timing or anything like that. But then when I got into the exam, I found that within the first 10 minutes, I was only 1 or 2 questions in. And I think the difference is when you're sitting this exam, you realise it's worth a lot more. Every word in the whole exam counts for quite, will make a difference to your final answer. And they're quite big paragraphs. You have to read the paragraph, read every option carefully, and then pick it. And it goes quite quickly. So I had to quickly pick up my pace to try and finish the exam in time. I'll go through why I thought it was different to the practice questions later on, but I did find it quite different. And I mean, some people are more cynical will say, well, it doesn't really matter. You should just work as hard as you can do and get as far as you can, because it's quality of your answers, not the quantity that matters. And that counts to an extent, but if you look at people's analysis afterwards, it does really make a difference if you finish or if you don't. And that's because of this thing which they looked at in a paper in the BMJ, which is called a low coefficient variance, which essentially just means most people's scores would clump together over here. So if you look at people who scored 40, that's 12% of everyone who sat the exam, which is over 1,000 people scored 40 out of 50. So if you drop 1%, you drop 1,000 places or so. So that's why a small difference in your mark translates into a big difference in your ranking. So they worked out if you miss out one question and drop the 20 marks, that equates to 2 points in your FPAS score in your ranking. So that is the equivalent of a 2-2 BSc if you miss out one question in this exam. So no, I'm not saying that you should rush through it to finish, because the way that the marking system's made is if you're clearly just guessing, and say if you've got 5 minutes left and you randomly put different options down, the machine has an algorithm supposedly that will catch you out if you are just guessing, and it'll give you 0 marks. So I think the importance is to pace yourself well before you go into the exams, and realise that and try your hardest to finish the exam, because you don't want to be throwing away marks just because of bad timing. Yeah, is that all right? So next, we'll have a look at a little bit of the background. So the exam was written by the Improving Selection to Foundation Programme panel, which was made up of an expert panel of professors and senior doctors who unfortunately hadn't done an F1 job in over 10 years at least, so they were a little bit out of date, but that's a different point. What they did then is they sat in a room, did a literature search of what F1s did, and that's really the main way that they found out what the doctor's job involved. They interviewed doctors, of which 40 were consultants and only 6 were F1s, to find out what F1s do as their job. And then they did 29 hours of shadowing, which is 3 to 4 days, which is less than secondary school students do before they apply for medicine. And then from that information collection, they wrote 127 pages to describe the 6 things that an F1 does. So only 6 things really, which is great. And then they put it into a nice table and broke it down into all these subsections and everything like that. And if you have time, I think it's worth a read, because each of the points they break down into examples. So looking at this, it says a consultant speaking to a colleague in an inappropriate way. So it shows you. I mean, the takeaway message from this point is really that you can't really be approaching this exam as what an F1 does, because that's not how these people are approaching it. They're approaching it as what their perception of what an F1 does. So based on their literature search, based on good medical practice, they've derived what an F1's job is. So although it is important to know what an F1 does, because that's what you're going to be doing, when you come in to sit the exam, you need to sort of look at that through the eyes of a professor. So really, this is what an F1 does as far as you're concerned for this exam, not what you see in the next couple of months. Although there is an overlap, obviously. And also the examples that they provide are quite good starting points for sort of syllabus or possible scenarios and questions that can come up in your exam. So it's worth a look. Right. So this is the next point, really. Of these 6 points, over the last 2 years and over the next 3 months or so, you'll have loads of experiences of all these sort of things. So, wrong medication to a patient, consultant being inappropriate, you'll see that happening. So when it comes to the exam, what I found really difficult to do was keep it objective. I mean, for example, say if there was a question focusing on say, a consultant behaving in a certain way, I straight away, I think everyone does that, you'll flash back to, oh, I saw this happen a couple of months ago, and this is what everyone said to do, this is what he did. And then straight away, you're not really reading what the question is asking you to do. You're contaminating it with your own experiences and your own idea or perception of what the question is. So I found it quite hard to approach these questions in scenarios where it says, you are the F1, blah, 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 in an objective way. So, I mean, it might not work for you, but what I tended to do was I didn't picture myself in those scenarios. I pictured an F1 called Dr. Duke. So when I was in your position 2 years ago, I was placed at Worthing, and my F1 was a really down the line, very almost robotic in a way of an F1, where he did everything by the book. And so when I thought of these scenarios, I imagined him doing these scenarios and thought, what would he do? And that way I kind of found it quite easy to take myself out of the picture and my own experiences out of the picture. I mean, if you're finding it a problem, it's something you can try, I guess. But yeah, I guess the message there is to not really focus on your own personal bias, and it's to approach these, again, through the eyes of a senior doctor looking in at these scenarios. And again, on a link point, something that one of my friends found was, don't try and remember similar questions. So when you come to the exam, over the next couple of months, you'll have done dozens and dozens of scenarios and questions, and maybe looked at books and things like that. And so when you sit the exam and you're racing through, trying to finish on time, you think, oh great, question about the drunk doctor. I remember in that book it said you should go to this person first, then do this second and third, fourth. And straight away you'll start formulating a response without really fully reading the question. And that's bad, because you haven't seen this exact question before. And really subtle differences in the wording of the question and subtle differences in the wording of the answers really do make a difference. And unfortunately, the doctors and professors who've made these questions in the question banks have put in a lot of time to make them quite detailed and ask for something quite specific. So each question is unique. And so although you might have come across one of the 6 topics before, I mean, you undoubtedly will have come across the 6 topics before in other questions, it's important to approach them with a fresh perspective and really take them at face value and not compare them to previous things that you've seen in the past. I mean, the people who are writing your questions haven't seen the books that you're using or the things that you're using as practice material, so there's no point really contaminating your answer with those experiences. So what my friend did was, a couple of days before the exam, he stopped looking at previous practice questions and just started reading, I guess, the syllabus and things like that, because he didn't want to have that effect, and it seemed to work for him because he did well. Next, I think I read somewhere that I think King's and Imperial actually do quite well in this SJT exam. My personal theory, which I guess doesn't count for that much, but is that it's because over the next 2-3 months before December, you'll be based on the wards, and your final year is quite a lot just an apprenticeship, where you're just meant to be shadowing an F1, you're meant to be following an F2 and finding out what they're doing. And that's pretty much what this exam is designed to be testing. So, it's a good thing that you're not really stuck in lectures all day. It's a good thing that you're on the wards. And that's because these questions will be designed revolving around the job of an F1. So they'll be talking about things like ward rounds, the daily jobs that an F1 does, the teaching that they do and the teaching that they get, how they interact with colleagues, on-call, CPOD lists, things like that. And if these terms you aren't familiar with, or if they're just words to you, then you won't really be understanding what the people writing the questions are trying to get at. So it's really important that you're familiar with all these concepts and you understand the importance of them, what they all mean, before you try and go ahead and try and make up answers about them. And I think the only way you can really do that is to spend time on the ward. There isn't really a book to teach you all those sort of things. So even if you are the sort of person who doesn't tend to go into clinics or whatever, I think even if you focus on just this as your motivation or reason to, it's worth it and it will pay off. The other reason why it's good to go in and why I think it'll help is because at the moment you're all final year medical students. But for this exam, they're expecting you to think like an F1, and that's not just in your mentality; it's in terms of your actions that you would do. And I think that's quite a hard thing to be expecting of final year medical students, because in a lot of the situations, if you found yourself in, you wouldn't do something, you would go and get help. But when you're an F1, there are a lot of times when you wouldn't be expected to get help in the first instance. You'd be expected to do something, and your attitude and perspective towards different scenarios and situations would be different, because you'd have a different set of skills and you'd have a different set of expectations. So again, you're not supposed to be approaching this through your eyes. You're supposed to be an F1, which is quite a hard thing to try and simulate if you haven't seen what an F1 does. If you haven't seen what an F1 thinks they're capable of, if you haven't seen what an F1 thinks they need to go and get help for, you won't be able to act like that if you haven't seen that. So I guess what your medical school is saying, go in, it is quite relevant, and it'll be quite helpful for those couple of different reasons. Okay? Alright, so I'll hand over to Charlene.
Hi, I'm Charlene. I'm one of the F1s at St Thomas's. I graduated from Cambridge, but we did the same exam. So I think what me and my friends did to prepare was that we kind of went to small groups and kind of discussed common themes that kept coming up. Especially because while we were doing those kind of practice books, we felt that sometimes the model answers were often conflicting, and we really didn't really know what the right answer was. So what we did is kind of collate kind of similar themes. And as Mikhail said, you don't want to kind of approach the question being like, I'm going to answer it this way. But it's helpful to have some idea about what to do when encountering a certain problem. And so with regards to escalating problems, you should always deal directly with the original person first, especially the person's made the error, and then usually your senior after that. With regards to patient safety, always the most important thing. If there's ever a patient involved in the question, always go to them first. If there's a drug prescribing error, just check that the patient's okay first before you fill in an IR1 form, for example. Professionalism as well. Always seek advice from your educational supervisors, then your peers, and also offer to help other people if it's solvable. Where to seek advice. Often clinical supervisors or educational supervisors are your first port of call before other senior doctors. And try to escalate to your own team first before other people's teams. And asking colleagues or other F1s are always good practice in all aspects. And usually doctors for clinical advice before other health professionals. And if patient safety is not a concern, do try to deal with things yourself first before escalating. Also managing time at work and looking after yourself. Often the theme is not to return to the hospital after you've left, but you should stay late if to complete important tasks that can only be done by you, but not for tasks that can be handed over. Usually routine things can be handed over, and that's why, as F1s we work as shift work. And always see your GP if you're ill. Don't make decisions about your own medical treatment alone, and don't prescribe for yourself. I think we talked about that already. And with regards to breaking confidentiality, the GMC has got quite a nice one-page guidance on situations where you can do this. And you should kind of know the situations where it is justifiable to break patient confidentiality. And I think it's usually when patient safety is at risk, where other people are at risk, and especially when child safety is concerned. But always try to inform the patient before you break your confidentiality. With regards to handovers, usually it's good to hand over to a responsible team, better than a non-responsible team. And direct handover is better than indirect. So leaving notes is rubbish, don't do it. And And don't hand over routine jobs to the on-call team, so that includes things like rewriting drug charts, warfarin prescribing. Just be nice to your colleagues. Patient concerns, you should always do the kind of normal communication, CCS things that I'm sure you guys are all proficient with run up to finals. But always try to ask and explore people's concerns even before reassuring them. And don't assume relatives would feedback what you tell them to their patients. And again, the confidentiality thing applies as well. You should always ask patients if they're okay for you to share their information with their relatives. But also, in patients who don't have capacity, it is assumed that they would want their relatives to be updated of the general progress, so that is an exception to that. Yeah. So just a general line of things not to do as an F1, or do on your own, is don't break bad news on your own. Don't discharge patients on your own. You should always get a registrar to do this, or if, in the very minimum, get them to kind of verbally approve it over the phone. Don't consent for things that you don't know the risks and benefits of, unless you're trained to do so, or unless a consultant registrar is there beside you. And don't accept referrals yourself from other teams. Don't prescribe outside hospital. And don't really act as a middle person. For example, if person A is concerned about person B, don't be the person to kind of pass the message. Try and encourage them to talk to each other. Don't give away your bleed. And try not to delegate clinical jobs to nurses. Cool. So just a general summary. With regards to the ranking questions, as Nicole mentioned, is try to read the question really carefully and try not to assume that they're like questions you've done before. Try to treat each answer as if they're completely in isolation. And if you're really unsure, I found really useful to kind of just anchor the top and bottom and then work on the ones in between. Especially because you get kind of marks for kind of partially correct answers as well. So you shouldn't worry if you're not too sure, just move on. With regards to the best three, try to get the three that you will do together and immediately, and just eliminate the bad ones. When you look at them, that's obviously wrong, just cross them off so it's easier visually for you to see what's the right answer. I personally found the SJT really push for time, because as you realise, you don't really, especially because the paper is structured, the ranking questions first and then the best of three. So you do kind of get caught up with the kind of minutiae of like, would this come before this? So just try to keep to time. And I would recommend doing the official practice paper kind of maybe a week before the actual thing and try to do it timed. And the official practice paper actually has kind of model answers, so you can kind of look through that and be like, okay, I'm not going to look at those practice books anymore, just focus on the model answers. And that would just really help clear your head as to what they're looking for. Cool. Good luck.
Hi guys, my name's Farina. I am also an F1 here at Tommy's. I went to Barts. Fabulous university. So Charlene has probably gone through quite a lot of these. But my biggest tip for you guys would be to make a list like this for yourselves. It sounds a bit weird, but I want, like, if you could imagine that you're going to teach next year and you have to compile a list of tips. Because I practiced, I did all kinds of things, I did the same things as my friends, and the only thing that I can think of that I did differently was that my brother went to UCL. And he was on his elective in December and then came back 2 days before the SJT exam in January. So I panicked for him and compiled a list of like, do this, don't do that, all that kind of stuff, before I sat my exam. And that's the only thing I can think of that I did differently, and then I did pretty well. So do that, and you might do as well as me. Yeah, so these are, I think Jolene went through these. My other tip, which is not on there, is to just kind of familiarise yourself, and like, I'm doing psych, so I'm going to use really psychy terms. Is like get a feeling for it. If you say it's different to revising for your medical exams. When you revise for your medical exams, you like want to get in there with the nitty gritty and like, you know, all the keywords and blah blah blah, and everything has to be really really correct. So like Lucy said, in the SJT you'll find when you're doing the practice questions, the flaming books, one thing it will say, oh, never break this rule. Question 17, never break this rule. Question 21, break the rule all the time. Like, it doesn't make any sense. So you just need to, don't get hung up on it. Some people got really hung up on it, start panicking and, you know, need to die before the exam. Don't do that. Just get a feel of it and a, you know, just a vague, really good understanding, and like, just really, really practice. Like, practice, 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 and immerse yourself into the world of SJT. That would be my advice. The other thing that Nicole said is, because it's so ridiculous, by the time you get to nearer to the exam time, and you would have gone through so many practice questions by then, yes, obviously, right? What I found really helpful was, I don't know the time frame, it's just a bit before, is to go onto the GMC website, the Good Practice, and they have videos, cases, so you watch almost like a role play between a doctor and a patient, or two doctors, or two patients, or a patient's experience, something like that. And then afterwards it has questions, like, or what would you do now, and how would you help Curtis now? And then they give you like the answers. And they're really good because it's kind of this, it's like in an ideal situation, what would you do? So it's like an audio SJT question. So yeah, do that. I found that really helpful. And again, Charlie went through most of these. Oh, the other thing that's really good is the SJT paper, is you should do that right at the end. And that should be like the last thing you do. And the model answers are really good, but I wouldn't advise doing the paper any earlier, because it's a really good thing to do as a last minute practice. Kind of gauge what score you'll get, kind of thing. But MPS have practice questions. Again, don't get hung up on their model answers, because some of them were crap, don't know what they were on about. But the questions were quite good, and it's a way of timing yourself. Even when you do the books, time yourself. Like it sounds really ridiculous, but the timing of the paper is so like strict that you need to get into that habit. That's so important. Okay, so because I'm doing psych, I thought, I don't know anything about this, I thought I would just give you like a brief thing on mental capacity. So again, there's a lot you can talk about mental capacity. It will come up in the SJT. You don't need to know everything about it, but the important things you need to know are that assessing mental capacity is done by the person who's doing the procedure. So if you as the F1, are not doing the procedure, you cannot assess the capacity unless, you can't, because it's somebody else. So in the same thing, don't call psych, just FYI, because I'm not doing the procedure, so I can't assess the capacity. So for whatever the procedure is, you have to assess capacity for that. Which brings me on to that mental capacity is action specific. So somebody can have the capacity to choose between a cheese and a ham sandwich, but not have the capacity to decide if they will take their medication or not. So it's completely decision specific and can only be assessed by the person who's carrying out that procedure. At the same time, it's also time specific. So straight after a stroke, somebody might not have capacity, but 2 days later, not really, 2 weeks later, they might regain that capacity. So you can't just assume that they didn't have capacity last week, so they don't have capacity this week. You have to keep assessing it. So yes, and then very importantly, everyone is presumed to have capacity. So even if they're making like the most absurd decision ever, and it's a really unwise decision, and you don't agree with it at all, you have to. That doesn't mean that they don't have capacity. You have to assume that they have capacity, and then assess it. Okay, so everyone knows about the understanding, retaining, balancing, and communication. The important thing is that all the information has been provided to the patient. Because if you don't provide all the information, they can't balance it, they can't do that. So that's actually the first thing you have to do. Then you have to make sure that the patient can understand everything that you've told them. They can retain it, they can balance the pros and cons. But the pros and cons, this is really important as well, of having and not having. So not just the pros of having it and the cons of not having it, because you don't want that. And then communicate it back to you, which could be verbally or written down or anything like that. Okay. Then the other important thing is that a person cannot lack capacity unless they have a disorder of the mind or the brain. So if they haven't got a disorder of the mind or the brain, you presume that they have capacity. They can't not have capacity. Yes. So if they, and then yeah. So then if they have a disorder of the mind or the brain and they're refusing physical health treatment, then you assess them under the Mental Capacity Act and you treat them accordingly. If they have a disorder of the mind, and the mind only, and they're refusing mental health treatment, then you have to assess their risk, and if they're high risk, you treat them under the Mental Health Act. Does that make sense? Thanks.
Great, so the next thing that we're going to cover is the different materials that are available to use. Charlene and Sadhana touched on it a little bit, but we'll go through them in a little bit more detail. Great, so these are the 5 things that I could really think of. If you guys think of any others, then we can maybe talk about them at the end. But there are the official questions on the website, the resources like the Good Medical Practice booklets, and the website. Then there are the homemade question books, which there were a couple available, which we'll have a look at. And then there are courses and teaching available, and then there are small group sessions, which I'll explain when we get to it. So as you could probably gauge, the official questions are really useful, and I think the biggest advantage is these are pretty much exactly like the questions that do come up in your SJT exam. A lot of the other ones aren't as accurate, and so these are by far your best asset. The only downside is there aren't that many of them. I think there are probably 70, because it's a practice paper. So that's all you really have from the people who've written the exam, and yes, that's all you're going to get, because I don't think they're going to release another one. So my advice with that is, I guess, that they found it useful to do it at the end. I'm sure everyone has their own different perspectives of when they like to do past paper questions and things like that. But the important thing with this paper is not to really get too caught up in the order of the answers, or whether you agree with how they've done it, or really what score you get exactly in this paper. And that's because I think the most important thing you can take away from this is you're looking at the paper through the eyes of the examiner, through the eyes of the author, the person who wrote the exam. So really what you want to use this paper to do is try and get into that mindset, try and understand what they're expecting from you. So I guess my personal advice would be to take your time with it, sit down with a pen and paper and write down what you're thinking. So if we look at questions, this is the first question on the practice paper. So turn away if you don't want to see it. Which is looking at basically at the end of your shift, and a CT scan has been done, but I think you forgot to chase it up, and it's a really important CT scan. You've gone home and you've remembered, and you can't get through to the F1 who's working overnight. So what would you do? And then there are 5 options here. So what I would say to do is rather than try and time yourself and rush through it as quickly as possible, sit down with a pen and sit down and look at the computer and try and think about what are the core duties, or what are the good medical practice points they're trying to get at. So I thought, when I looked at this obviously afterwards, when I had a lot more time on my hands, and when I thought about doing this, is I spotted some things saying patient safety, and I thought, okay, that's one of the points that they're trying to pick out. Incorrect handover, there's another point that they're trying to pick out, and then work-life balance. So I thought, great, so I've tried to figure out what the examiner was trying to get at with these questions. So whether I get the right answer or not, I've sort of figured out what the question is asking and what the difference is between the different answers. It's the way that they prioritise these core duties. And then, you can then just sit down and rank them all in your order, and then have a look at the blurb at the end. And again, if you look at the blurb at the end, that's quite useful explanation, but this is written by the correct people, where they talk about your responsibilities, handover, and patient safety. And you can see that mirrors really points that are there in the question and the options. And so that's a good way really of really understanding the concepts of this exam and understanding what they want from you. And then obviously, if you get the right answer, that's an added bonus. Next is the resources. So I'm not sure whether you get the actual hard copies of the books anymore, but you can obviously find it on the Good TMC website. I think there are 6 of these little booklets. and then there's a person specification of what they want from FPass, what FPass want from you actually. And they're really as close as you're going to get to a sort of a syllabus or a textbook. And although you can sit down and blitz through one of these a night, or go through them all as quickly as you can, I think a better way to use these is to try and figure out what the concepts are they're asking you and how they can be applied in an exam format. So if you flick through the child protection book and there's a point about the importance of safeguarding, or when you would escalate to your senior, you can think, okay, this is a point which an examiner would have looked at. What question would they try and make about this? So you can try and think, okay, they might try and say this is more important than this, or that's more important than that, or they might try and relate in this other aspect. So all these books are really useful, but again, it's not something for you to sit down and read like a storybook, or sit down and read like a textbook, like you were saying. It's not facts to be learned, it's concepts to be familiar with, which is a lot harder really to get your head around, but it's something which, I guess, if you combine that with your experiences on the ward and everything you've done over the last couple of years, and then try and relate those experiences to the things you find in this book, that's probably the best way to use them. So, as a link to find out what's important. Next, question books. These were the ones that I found on the internet. I'm sure they're probably more available. I guess they're good if you're the sort of person who likes to fill up time by doing lots and lots of questions and try and learn through that way. I think they all have little explanations at the back. The only downside is they're not really written by anyone official. They're written by GP trainees, by consultants who come home in the evening and write some questions to try and make some money by selling books. So they're not really coming from the same place as someone who's got a full-time job of making these question banks, and from that point of view. And I think the biggest problem that I found was that it almost lulled me into a sense of complacency. So if you look at this question, which was about someone drinking whiskey on the ward or in wherever, straight away you've got two answers here, B and C, where it goes, don't do anything about it, which is ridiculous. Even a 10-year-old kid would know that's not the right answer. And so straight away you've eliminated two, there'll probably be one perfect answer, and within 10 seconds you've already ranked 3 of them. And that really is not what the actual exam is like at all. I found that every question and every answer every answer to the question was pretty feasible. Some were a little bit more wrong than others, but there was nothing as black and white as this. So whereas you can here only be ranking 3 answers and get through it in 30 seconds, in your actual exam you have a much longer question and much more complex answers. So don't really sort of use these books if you want to, or if you find that helpful, but you can't turn around if you do badly in the exam and go, oh, I came across this question in this book and they said to do this, because 1, it's written by the wrong author, and 2, you don't know where they're getting their information from. Well, you do. It's coming from them reading these resources, which is no different from really you guys reading those resources and generating your own questions. Next, there's lots of courses. I think there's another one tomorrow. Yeah?
Oh, that's
at some point which King's puts on. And then there are lots of the sort of unofficial ACE medicine courses, things like that, which can be great. But again, big warning sign to those is that, again, it's made by people who are GP trainees, or people who, I heard someone told me that there's one by someone from last year's final year who did really well in his exam, is charging £80 to train, to coach students. So, and I think the thing is, when you get caught up in this hysteria of, oh my God, this exam's so important, and you're sat there thinking, where's Yeovil? I don't want to go there. It's really easy, it's almost predatorial for people to go, I see a market here, I passed the exam, I can convince them that I know what I'm talking about to come to my course. Obviously, there are some good things to take out of these courses. If you're the sort of person who doesn't like to actively go and look for your own information, or you can't be bothered to go and look at your own good medical practice booklets, then I guess this is the way someone will spoon feed you what they've read in the same books that you have access to. I guess sometimes they can be good. If you've got no idea where you're going, if you've got no idea what you're doing, they can be good. If you learn that way, they can be good. I guess it's each their own, really. But again, these are self-designed questions and different to the thought questions you're going to get in the exam. Next, this is sort of my key tip, and that's to try and work together for this exam. you're against, I don't think you should really think of it as you're against anyone really, because there's such a large cohort that it's not worth thinking about how other people do. You should really try and come together and try and talk about these things, because like I said, these aren't concepts for you to be learning in a book. It's something you need to be familiar with. So it's not something you can sit by, well, I mean, you can sit by yourself and try and become familiar, but the best way to become familiar with any sort of concept is to talk about it and listen to what other people have to say. So one of my issues was, when I started revising, I always thought, when I did a question in a book, I thought, that's wrong, I'm right. And I was convinced that I knew what I was talking about, and that my opinion should have been the right opinion. A lot of the times, I sort of made my own judgment calls on the things that I read in these books, and in these good medical practice books. I thought, okay, that's why this is important. And then the first time you sit down with a couple of other people and maybe do questions together, or go through something that you didn't really understand, you hear what someone else has got to say. You realise that your opinions will be made up of your experiences over the last 3 years. If you sit down with 5 other people and go through these questions, that's 15 years worth of experience you've got right there, and they're all very different. And I remember sitting down talking to someone else and doing a couple of questions. I was getting all of them wrong, and she was getting all of them right. I had no idea what was going on. And then we obviously sat down, spoke a little bit, and other people are a really valuable tool here, because I think more than any of these books, because you've got someone there with an opinion who can think themselves, and that really, I can't stress it enough how useful that is as a revision or a practice method, because your opinion isn't always the best opinion. And so I guess when you're on the wards, if you've got your F1s and they say, oh, do you want some teaching, or you've got a tutorial that isn't happening or something like that, this is something which a doctor can facilitate, which means there's someone who sat this exam before, who knows what they would do in these situations. So they could perhaps sit down with you guys, talk to you about some of the situations they've seen, what their rationale is. So it's a good way for you to use your F1s, and in exchange you can give them feedback forms, which they really want. And so that's another way of doing these sessions. But really it is about getting together with other people. And if you're in a DGH at the moment, or if you're in the GP group and you have those seminar groups, that's a ready-made group of 6, 7 people here who all have the same aim to try and do well in this exam. So, no harm at all in talking to other people and trying to figure out what their opinions are. And also, as you heard, between the 3 of us, we've all said some pretty different things in terms of what we stressed as important factors. And I think that just shows you different people can approach everything in different ways. And if you talk to someone else, find out something that they're doing, that could really count for a lot in your practice. So go ahead and do that. Next, so what can you be doing now? I guess you've got 3 months left before your exam. So again, I guess this is some sort of a summary. Like I said, go on your clinical placements, because that's a good way to become familiar with what an F1 does. And it's a good way to try and sort of look at these sort of scenarios through the eyes of an F1. And also, you've got the doctors who do the job there if you want to talk to them about anything in particular that you don't understand. So there are 3 different reasons to go in. 2, small group sessions. So get some friends or get some colleagues together and try and go through these, even if you only do it once or twice. And if it doesn't work for you, you don't have to do it again. 3, there's the online question bank, which is good. And you should all use it however you see fit, and take the blurbs at the end as a learning tool rather than using it just as a practice paper where you just get a score from. And 5th, I think take it seriously. Give it the time it deserves, because it is important, and it is something you can prepare for. Maybe not as much as you can do for your end of year exams, but it is something where I think you can definitely make an impact on by preparing well. And you don't want to be looking back in January thinking, oh, I wish I'd done this, I wish I'd done a little bit more. So give it a good shot over the next 3 months, and hopefully you'll all do well. So next is questions. Before I do that, last year we did this talk for the first time, and it went down quite well, and we got lots and lots of feedback on what we should be doing differently. And it was get more doctors to speak, get more handouts. And I know there are a lot of you still without handouts. And I think it's going online on Wednesday. So you will all get a copy of it. And if you don't, you can email them and they'll send you out a copy. So don't worry about not having handouts. That's something you will get. But if you have any other advice or any other tips, we also were told to do it earlier on in the year, which we have done. So please, 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 really do take now as a couple of minutes to do the feedback forms. Tell us anything we can do to improve it, or what sections worked well, so we can make it better for next year, because this is the only real feedback we get about this. So, if you can, that'd be really helpful. And then in a couple of minutes, we'll go through any questions you guys might have.